So we're going to move to example number 2, which is the folks from vSim for Nursing, Laerdal Medical Corporation. So their example 2, where are Laerdal folks? Okay, your mic's hot. Hit the timer.
Okay. Thank you very much for having us here today. We're excited to be talking about innovation and technology. We are from Laerdal Medical. Our mission is helping save lives, and we've been doing that for over 50 years through education and technologies to assist with that education, from patient simulation to task trainers to virtual simulation, which is what we wanted to share with you today. So vSim for Nursing is a computer simulation developed to focus on clinical reasoning, critical thinking, competence, and confidence for the nurse. It also includes instructor tools to assist with monitoring progress and assessing with comprehension. vSim allows the students to interact with patients in a very safe, realistic environment online through nursing scenarios. The user must apply nursing intervention rather than just making sequential guesses. Simulation utilizes technology of patient simulation by requiring the user to click through the correct path of treatment and virtual setting. Each decision is recorded and measured against a validated algorithm that generates a user proficiency score. The user can go through the scenario multiple times, and they may be doing that to increase their proficiency score or just to maintain competence in a certain skill set. Virtual simulation for nursing includes 72, I have dyslexia, 72 virtual sim scenarios ranging from mental health, gerontology, maternity, pediatrics, to health assessment, med-surg, pharmacology, and fundamentals. Now, application of technology in your learning environment is the real win, so we wanted to take just a couple minutes and provide a couple of examples of how virtual simulation for nursing has solved different problems for different end users. I'd like to start with Moravian College in Bethlehem, Pennsylvania. They had aspired to be a fully digital campus, and because they wanted to enhance the learning they were doing with the 21st century learner, which I believe we talked about earlier this morning. They were easily able to integrate vSim into their overall curriculum, so it helped meet that goal of a digital campus, but it also brought simulation into the classroom. So it provided just an additional opportunities for some hands-on engagement for the students in their learning environment. Also Midland Tech in South Carolina. They have a very large enrollment, 400 students, 400 nursing students a year. And with the high competition in the area with other sites, we were talking about that earlier, high competition for clinical placement. They were having a real struggle specifically with pediatrics. When they found placement sites, some of the students were having to travel a very long way, several hours at a time, to more rural settings to find that. It became very expensive for both the student as well as the college. So they took a look at what they were doing. They were doing standardized or regular patient simulation, and they started integrating vSim into that. By doing that, they were able to replace a portion of their pediatric clinicals with the introduction of virtual simulation. vSim for nursing is not just for nursing schools. It can also be utilized inside of a hospital setting, as we've seen with the University of North Carolina Women's Hospital. They were seeking to have a cost-effective and efficient way to address the ongoing training for high-risk, low-frequency OB events, and like most hospitals are doing. Now, they conducted team training on a regular basis using traditional patient simulation, but they were looking for a way to do something in between because those were spaced out, and they wanted something effective and efficient and cost-effective to do that. So they brought in incorporated vSim to provide to the nurses so that they were able to have an opportunity to continue to upkeep their competence in those skills for shoulder dystocia, all of the other types of emergencies that they would experience. The last one I'll tell you about, because I have a minute left, is at Belmont University. They have a fantastic simulation lab. They are all about driving the teaching for, again, the 21st century learner. And she decided, Beth Hallmark decided that she was going to use virtual simulation as a way to get that competition, those competition juices flowing. And so vSim is now their ticket, so to speak, to enter into the simulation lab. She gives them a target proficiency score that they need to get in order to come into the lab. But what she's seeing is that even though once the students reach that target, they are continuing to go through it. They want to get a higher score and higher and higher, or I want to get a higher score than you because we've talked what each of us got. So they plug into that competition that is going and moving forward to really drive the learning opportunity. We will be here at table 2 and would love to show you more about vSim.
Thank you very much. Thanks to the folks from Laerdal. They've been in the simulation and innovation business for a very, very long time. If you remember the Recessa Annie, that was a Laerdal product, the one with the fold-out foam legs.